Welcome back to Citizen Live at 1. We have our studio interview at the moment to discuss the health workers' strike. And in studio we have Dr. Nyikal, who is of course the former permanent secretary to the Ministry of Health and the senator to Seme. Good afternoon and thank you for joining us. You are of course both a politician as well as a doctor. So I think that you are in the best position to give an informed perspective on the issue. And I'd like to begin by just outlining what are the core issues here that are really fueling this health workers' strike.
I think the core issue in the broader context is basically the process of devolution. Let me immediately start by saying that health must be devolved and is in fact devolved, and the issue here is the process that it has taken. When the Constitution was written, it was very clear in Schedule 4 what functions are national government and what functions are county government. That was put very clearly. On top of that, the Constitution also recognized that this needs to be done in phases, and therefore Section 15 of Schedule 6 of the Constitution made provision that an act will be put in place that will guide the devolution. And so the transition to the Devolved Government Act was put in place that clearly stipulated the phasing in the process of devolution. And in my mind, this is the part that was actually done as was indicated in the Act, and therefore the health functions that were broadly in Schedule 4 were not unbundled, were not costed, and then the preparations necessary are really not put into place so that the devolution was done basically at once. And this has given rise to several problems in the health sector. And I think the strike that we are seeing now is just one of the problems that arises from the fact that we did not face devolution as we should have done. And so what the health workers are really worried about is their terms of service, their training, their progression, and even their terminal benefits that are now quite clearly stated when they're in the national government situation. Of course, the law, the County Government Act, gives a provision of this under 138, but like all acts, it broadly says what needs to be done, and then you have to go down and do the details of how that will actually take place. So what the health workers are worried about is that they are going there and there is no framework or policies that guide their devolution. And that, as far as I know, is the crux of the matter.
And could this be what is informing this, this health law that the health workers are pushing for?
Well, the health workers are just saying that we are going to be devolved. I don't think they are saying they don't want to be devolved. I think they realize there is no going back on devolution. All they are saying is that let's put the policies in and the laws in place. And from the discussions that I've gathered, some we get in the newspapers, is that they actually are asking that the policy be in place, the health law at least be published, because I don't think at this point you can say be acted, because that's a very long process. It can't be enacted now. And that the law, basically, the way I understand it, will give the framework under which they work. Because one of the national functions is actually a health policy, and that will also include regulation. And I think this law will then make that regulation and encompass also the policies that they are talking about. So in my mind, we have a problem of process, not a problem of whether we should devolve health or not. That's not an issue at all. Health is devolved. The issue is how is it devolved. Okay. And even if I were to tell you a bit, Article 24 of the Transition to Devolved Government Act says the criteria for devolving would be whether there is in existence legislation relating to the functions applied for, whether framework for service delivery has been put in place for the function, whether, where applicable, the government has identified established administrative units related to the function, whether the county government has undertaken capacity assessment. You see, if you look at all that, it was clearly stated what needed to be done before this was actually implemented. And that, in my mind, and what I gather from the health workers, is the problem. And let me say, I do agree with them that it is important that those are put in place.
Mm-hmm. Okay. Well, you know, I think what the health workers are asking for doesn't sound like it sounds very reasonable. You know, they want a framework in place. What is the governor's perspective, and why is there a solution not being sought? What is the core issues? Because it seems quite reasonable what they're asking for.
Also have a difficulty in understanding why this issue should be so difficult to resolve, because from the governor's perspective, they want health devolved immediately. And probably have no problem with that. But then there are issues that arise with that, and one of them is the human resource. And in my mind, if time was given, and the provision is there even in the County Government Act 138, Article 138, which says that these workers, once they go to the counties, they stand, they are still part of the national government workforce, but they are working at the counties. That is provided, and that they will not lose anything. But that is broadly provided for. So I would have thought that even this provision of asking for some time when these problems are resolved would quickly, is quite in line with what is in the law. So I have a lot of difficulty understanding why, if they say, okay, for so many months that they agree on, the remunerations stay at the national level, but physically the people work at the county and they are accountable to the county government. It is just their terms.
I'd like to know, what is your perspective on the solution to this health workers' strike in terms of actually reforming and having the health service actually delivered to Kenyans? What is the solution out of this?
In fact, in my mind, they should agree, one, the health workers must really work at the county. There's no question about that. But the issue they're asking for, like a policy framework, like a legal framework, I think there are two policies they're talking about. And from what we are reading and from what I've gathered from them, these are things that are in process that can take a very short time. So I don't see why the salaries or the remuneration should not still be paid from the national level. In fact, what has been happening is that this money was devolved, but the national government is paying and the county government is reimbursing them. I don't see why we cannot continue with that for the few months that they are asking for, while in the process the policy framework is being worked on. And as far as the bill is concerned, the best in my mind would be to say a bill is at least published, because asking for it to be enacted is a long process that the people involved in the discussions at this time may have no control over, because that will go to Parliament, their Parliament process. But publishing it is something that can actually be done, in my mind, within the time.
Okay.
So I read today with a bit of hope in the newspapers that they seem to be, the discussions seem to be following that line. And if we can get that done, so that for those few months they're asking for, their salary remains where it is and they get paid. In the meantime, the policies are put in place. In the meantime, the bill is published. It will be then discussed later on, and work goes on. Okay. Because for me, this is not just like any other strike. I mean,
it has
for example,
real
for example, if
sure.
you had a problem with the schools and there was a strike, you can extend the terms and the children will recover. But those who die in this process will never come back.
I completely agree. It's absolutely
Yes.
essential. Unfortunately, we are out of time, but thank you very much for your perspective. I think that you've outlined quite a comprehensive avenue to a solution which desperately needs to be sought, especially as the strike enters its 11th day and Kenyans do, in fact, continue to lose their lives.
Maybe we have one last moment. I think being very hard on health workers and kind of browbeating them back to work is not very wise. It is very bad to have a demoralized workforce that has been forced into work. You need to be committed to the work at heart, but that cannot be achieved by basically browbeating you using the force of power.
Yeah, well, that's a fantastic perspective from a doctor as well as a politician. Thank you very much for joining us in studio. That was very, very insightful to get your perspective on the issue. Now, back to our top story, where we're covering the Bomachoge election.